Good afternoon, everyone. My name is Lisa Bates. I am the CEO of Sacramento Steps Forward. I'm so appreciative of being here today and for Valley Vision for hosting this conference. And I would like to start with sharing a story with you all. And as you listen to my story, I ask you to notice within yourself what is going through your mind, how are you reacting, and what assumptions or conclusions are you making? Last summer, I was driving down Highway 50 going west, and my car started to sputter, and I realized I was running out of gas. I managed to make it just to the top of the Harbor Boulevard exit in West Sacramento when it came to a complete stop. I was not sure what to do next. So, do I call AAA? Do I get out and have somebody help me? Do I go to the gas station that was just down below and get a gas can and some gas? So I got out of my car and started to look around. Immediately, a woman came over to me at the side of the embankment to see how she could help. She had been sitting there with her dog at the intersection with her belongings and a sign asking for money. Noting my indecisiveness, she immediately steps out in front of my car, the back of my car, where the oncoming traffic was coming on, and starts flagging cars to let them know that my car is disabled. And while flagging the cars, she was shouting at me over the noise of the traffic, well, why don't you get in and steer, and I'll push it down the hill. She was problem solving at the moment. And as I asked her to kindly move over to the safety of the side of the road, I realized that none of these options were very good. Flagging cars in the middle of the on-ramp, trying to push a car downhill with just two of us. So instead, I said, could you take my credit card and go down to the gas station and get a gas can and some gas and come back? And she said, sure, will you watch my dog? And I said, deal. So she went down to the gas station. I'm managing, making sure that nobody's hitting my car, watching her dog. And after a few minutes, she comes out victorious with the empty gas can, goes over to the gas stations, and was able to have somebody help her fill up the gas. She comes back up and greets me, and we faced another hurdle. I don't know about you, but these new gas cans, I can't figure out the safety feature in them. So I was struggling, and I could not get the gas into the gas tank, and I just the moment was too terrible for me. My friend immediately goes over to the side of the road, picks up some paper, makes a funnel, comes back and says, let's just open up the gas, put the gas in the funnel, and then we can, be on our way. Luckily, we had another motorist stop, show us how to use the gas can, get the gas in the car, and I was able to get it to safety. There's a lot more to this story that I could share, but what really happened in this instance, and I learned so much that day, is that from this brief encounter, we connected some of the conversation you just heard earlier, and we trusted each other with working toward a goal, even one that my friend was not responsible to address. I learned so much from her that day: the persistence, the can-do attitude, the adaptability, the resourcefulness, and innovation in the moment. In fact, here was a woman with little means, unhoused, who came to the aid of a stranger, jumped in with both feet to solve the problem at hand. We also really showed up without any preconceived notions, and aligned just wonderfully toward an aim, working in tandem to address this issue at hand of my car being stalled. Today, as you know, Valley Vision has created a space for us to come together, many of us strangers, to dialogue, reflect, and even act on how to make our community more livable for all of us. We do have the choice, and we do have the power of how we choose to show up. Many of us can continue to take this dialogue well beyond today's event. And we know that homelessness is a whole community problem. It affects all of us, and it is larger than any one of us, any elected official, or any organization's responsibility. The good news is, and I forgot to click. It's the green. See, can't figure out the basic things in a moment. The good news is our community has built a roadmap through the collective action of many working to solve homelessness. We know the interventions that are needed to prevent, respond, and end homelessness. We know that we need to focus on reducing inflow into homelessness through all of that upstream work that was so beautifully shared a moment ago, and with more direct prevention and diversion strategies for people just about to enter homelessness. We know we need to improve the outcomes of the investments we are making in the urgent crisis response of sheltering and outreach. And as this conference has so highlighted, continue to invest in the permanent housing with services and supports to resolve the condition of homelessness. And we need alignment among our partners to turn our many fragmented efforts into a unified approach using data, focus, and coordination. Good news is this summer, the City of Sacramento, the County of Sacramento, and your Homeless Continuum of Care adopted a 6-part strategy that will move our community from responding to homelessness to ending it. This set of strategies is grounded in data with insights from persons with lived expertise and those working to resolve homelessness. It builds transparency and accountability by pinpointing how and where we need to focus our resources and efforts. Much of this data-driven work has been built into the new Regional Homelessness Action Plan. And in the coming months, you will hear more about the implementation of these strategies, and you will learn how we can measure ourselves on the progress of improving the lives of unhoused. There is no silver bullet, but through coordination, collaboration, and your support as leaders of our community, we can get there. We hope you will join us in supporting and contributing to the success of this collective effort, and we at Sacramento Step Forward are looking forward to working with all of you. At this point, I'm excited now to introduce our panel of changemakers. They are individuals that have gone above and beyond their normal daily jobs with passion and commitment to improve our community and its residents. With us today to share their insights is Dr. Jonathan Porteus, CEO of WellSpace Health. Many of you know WellSpace Health, a regional community health system that is providing mental, dental, and behavioral health care to approximately 1,400 people every day, all of who are in poverty and thousands who are experiencing homelessness. I would like to also say he is the former member of the Sacramento Homeless Continuum of Care and a current member of the Sacramento Steps Forward Board. Next to him is Angela Upshaw. She's the Director of Programs at Berkeley Food and Housing Project. They are a homeless service provider here in Sacramento, despite the name. And she is also the current vice chair of our Sacramento Homeless Continuum of Care. And she is the co-chair of the very important COC Racial Equity Committee, since you've heard so much about disparities today. Next to her is Dianna Pogetto, who is the executive director of the American River Park Foundation, and she brings various community interests together to protect the 23-mile, 4,800-acre parkland. She also has been involved in shaping policy for persons with disability, for homelessness initiatives, and child welfare. Next to her is Jeneba Lahai, the executive director of Yolo County's Children Alliance, a nonprofit that provides wraparound services and direct services to families in need, and also serves as the Child Abuse Prevention Council of Yolo County. She sits on numerous boards, including the Yolo County Homeless Continuum of Care. You seeing a theme here? Next to her is Honorable Vice Mayor Rosario Rodriguez, who is from the city of Folsom. She's elected to office in 2020, has an intent on making a difference in homelessness. She is a business owner of the Sutter Street Taqueria restaurant, and she is a member of the Sacramento Homeless Policy Council. One last thing I would like to say is I'm aware of 3 other Continuum of Care board members in the audience today, so just would like to acknowledge them. Erin Johansson, the CEO of Hope Cooperative, who is our COC chair. Christy Gonzalez, also with WellSpace Health. And Stefan Heisler, who is with Rancho Cordova as the housing program manager. With that, I will turn it over to Evan, who's going to lead the panel.
All right. Thank you. Thank you so much for that, Lisa, and thanks for starting with that story. That's a great way of getting us to kind of open our minds and think about things in a different way. So pleased to have all of you here with us and really appreciative of you coming and lending your expertise. I want to acknowledge right off the bat that we have about 30 minutes total to talk about an issue that we could easily talk about all day. I know this is not only an issue of great concern to everyone in this room and to the region as a whole, but also an intense challenge that we're grappling with and that has gotten worse in the last couple of years, as we've acknowledged. So I think our goal for this short period of time that we have is to share some different vantage points, to hear hopefully some inspiring solutions and ideas about how we can advance these solutions in our region. And my hope is to open a door to an open dialogue, to new learning, and a way of connecting with each other around this issue that really needs transformative change here in the region. So with that, I want to get right to it. And I think the question that I'll put out to all of you is, first, tell us briefly a little bit about the work that you're doing around the homelessness issue, and tell us what would you like the audience to know from your vantage point in the work that you do. And I'll go ahead and start over on this side with
Okay,
Rosario.
I'll make it really long story short. For the city of Folsom, when I was elected in November of 2020, one of the things I noticed as I started meeting with people, because homelessness is something that's very personal to me. I am a native of San Francisco. I saw what happened when you don't move as fast to get action into a problem such as homelessness. So I met with nonprofits, I met with our police department, with our navigator, and one thing I noticed is that there wasn't a communication amongst these key people. So after several coffee, we sat down and had coffee and talked, we realized that we needed to come up with a strategic plan on how we were going to handle homelessness for the city of Folsom. And from there, we ended up having a 3-day event that we used lean methodology, we created an A3, and we identified some problems and some solutions. And so from that was birthed the Folsom Alliance for the Unhoused. And so what it allowed us to do was communicate amongst really key people, the people that were doing the work to getting services to our unhoused. But one of the things that I think has been really the aha moment is that we can get people to services, but ultimately it's getting them to stay, to get through the service, and then come out and be a successful, just be a citizen in our community that can have a job, make money, and take care of themselves. And so I think one of the big things for me is that we have a large group of people that have severe mental health issues, schizophrenia, severe bipolar, and what we have is a revolving issue where they get arrested, they go to jail, they come out, and it's just becoming a revolving issue. And so I would personally just love to see more something on the lines of to the severe, those with severe issues that cannot take care of themselves. And I think that's like one of the big issues that we're just not seeing for the state of California.
Thank you, and thanks for sharing the work that you're doing in Folsom. Jeneba, we'll go to you.
So Rosario and I are the outlier in this. We're representing communities outside of Sacramento. At Yolo County Children's Alliance, we are the Child Abuse Prevention Council, and we see the child as the center of our universe. So as an organization, we work on issues and policies that affect the child in its immediate environment. And housing has been something we've been working on for many years. So in addition to having a prevention program, our housing prevention program basically prevents people from being homeless. That's when someone has an emergency come up. Many of our families are living paycheck to paycheck. That is the reality of it. And we're in an economy that continue to rise, the cost of living continue to rise, and jobs are not catching up to that. So when someone has an emergency come up, we prevent them from being homeless. Or if they are homeless, we assist them in finding housing. In addition to the prevention aspect of the work that we do as an organization, we also provide wraparound case management for Project Home Key and Room Key, which is mostly a transitional housing opportunity that came up in West Sacramento. So although we're working on those two specific projects, but collaboratively within the county, we're working very closely with the COC. which is the continuum of care. Prior to the pandemic, our COC was a loose coalition of organizations meeting on a monthly basis, trying to figure out how to wrap our head around this issue that's been affecting our region. And one of the things that we did, we brought in some technical assistance from HUD. HUD created this plan of action for Yolo County, create a commission that is made up of elected representatives, including the chair of the COC, as well as a nonprofit organization. So our COC became the nonprofit organization working closely with the commission. And on the commission, you have city representatives. On the COC board, you have city representatives as well as organizations working on homeless issue. So it created this coordinated effort between county, cities, nonprofit organizations, faith-based organizations, as well as businesses. We have a strategic plan. We just updated our strategic plan. We're working on an action plan right now collectively to address homelessness in our community. But from my vantage point, the face of homelessness is the working poor. During the pandemic, we had inequalities before the pandemic, but the pandemic has increased that. And you do have people who are making an effort, but their effort is not getting them where they need to go because, again, cost of living keeps increasing. Thank you.
Yeah, Dianna.
So you might wonder, why is the American River Parkway Foundation Executive Director sitting up here, and what do we have to do with homelessness? And unfortunately, we are ground zero for homeless within Sacramento region. So our 4,800 acre, 23-mile beautiful parkway, which to me, and hopefully everyone in this room, is the greatest civic amenity within this region, has 2,500 to 3,000 homeless individuals residing on it. We do know this because we have mapped all those camps out on the parkway. It is a humanitarian crisis that is occurring on the parkway. What are those effects to all of us in this room? It's our water quality. It is the environmental degradation, which will be 50 to 100 years to take care of. But more than that, it's the fear that people have that they don't want to go out onto the parkway. And for a region, an entity that has over 8 million people visit it per year, that's twice as many than the Crocker, than the Kings game. 8 million people visit the parkway. And when people don't want to utilize the parkway because of fear, that means the parkway is going to disappear. And we as a region cannot have that occur. So we have gotten into the homeless policy topic because you can't just move the individuals from the parkway, because that's almost playing whack-a-mole. And I know that sounds really harsh, but you can't move them and just expect them to go live on a street corner, because that's not solving the issue. So we are working to find suitable land in which additional shelter space can be opened. So all of us in this room, instead of being a NIMBY, when it comes to finding shelter space, let's embrace it and say, how are we as a region going to improve, and how do we find that appropriate space, whether it's 20, 50, or 100. And most crucial is to provide those support services that are needed in order, whether it's mental health treatment, drug, alcohol, in order for the individuals that are residing on the parkway, on our streets, to actually get the services they need. Because I don't think any of us want to see another death of an individual because of a homeless individual, or see another homeless individual die. So I think all of us collectively need to look for shelter space and to move forward and say, yes, they all need support services.
Thank you, Dianna.
So as Lisa mentioned, I work with Berkeley Food and Housing Project, and we've obviously outgrown our name. We're changing it this fall. But we have a program here in Sacramento where we help veterans and their families exit homelessness. We do a lot of street outreach, case management, and rapid rehousing services. And so we've been doing that in Sacramento since 2017. In my other capacity, I am the co-chair of our Racial Equity Committee, as well as our COC vice chair. And so with our Racial Equity Committee, it's a brand new committee to the COC, and I'm really proud to be a part of that because we put together an action plan to address inequities in the homeless system and the services. So it's one thing to make sure that we're working to try and help everyone get out of homelessness, but we know there's huge disparities in who's experiencing homelessness, and it was really important for us to acknowledge and see what Sacramento's doing well and what we can improve upon to really make sure that housing is equitable, and the services that we're providing to people are equitable. One of the things that we do within our agency that we're looking into more is really looking at the data and seeing who we're serving and what the outcomes are, because we know we're being fair and treating everyone equally when they're coming into the program. We want to see who's actually finding housing and why are some folks not finding housing. So we're really looking to our staff and the data to make sure that we're having equitable practices within our agency and our programs. So that's just a little bit, and we'll talk more.
Yeah, thank you. Yeah, Jonathan.
Yeah, thanks very much. It's great to see everyone. I run WellSpace Health, and we are a health and behavioral health system of care for the least fortunate in the region. We're very honored to serve the majority of people who are unsheltered as our patients. Although they represent, at this point, a fraction of the overall number of people we serve, they are definitely a group of people who we're really passionate about. We have specialized programs for, we have street nursing, 2 full-time nurses just taking care of people on the street where they are, with a lot of outreach. I like to say, I'm a psychologist, but so this doesn't sound good, but I like to say we're very codependent. We look for solutions, and we create solutions. And this is the great sort of hardship for me, is that I'm looking at a bunch of people with whom I have created solutions over the last 20 years. We have taken care of some incredibly thorny issues. Those of you from the health systems here, we took a 3,000 patient a year environment, WellSpace Health, and took it to 130,000 patients a year, because we figured out that people who need care are in the wrong place, and they were suffering, and they were ruining it sort of for everyone, and we created the right place for them. So I believe that we know how to have solutions. The thing that concerns me is that we haven't got to that yet. I sometimes say that we're like the children of divorce, and often the kids in a divorce situation are just waiting for the parents to kind of figure out to agree. The parents may sort of say, oh, I'm going to get you this in your room, and the other one says, I'll get you this. There needs to be consensus. I think when Lisa talked about this strategic plan and bringing everyone around these 6 common goals, this has been critical, but it's taken a really long time. And beyond that, everyone needs to get involved. Everyone needs to have a common idea of what housing interventions are. We believe that housing is a vital sign. It's the 5th vital sign. We know that the people we serve get better if we just give them shelter. I have adjusted in the last 5 years, I've adjusted my idea of shelter to include a tent. Before that, I refused to work in any program where tents were involved. But at this point, even that could classify as a form of shelter because we're so desperate. But we need consensus. We need everyone to agree that this can happen in their backyard. And we need, as we heard, we need places for people to go. It's one thing to move people off the parkway. It's another thing to bring them to a home. And that is the great consensus that we need to find. And currently, I think as the children of divorce, we keep asking for that to happen. I think it's happening in this policy council.
Yeah, thank you. Thank you all. I think I heard this theme a variety of times, is thinking about working together, and it sounds like, and I think most of you have created partnerships and connections that maybe you didn't expect to as you were, kind of getting into this issue and how you could work to solve it. So would love to hear your thoughts and your advice. How can we work together as a region or as communities to address this issue and to help house those who don't have housing here in our region? And I'll just kind of, I'll allow anybody to jump in with your thoughts on that.
I'll share, as Lisa mentioned, the local homeless action plan is a great start, where we did a gaps analysis to see what the needs are, what are we doing in the community, and what are we missing, and then putting together a plan on how we can meet those goals as a community. Far too often, we work in silos, our different government agencies, different service providers, everyone's doing their own thing, and a lot of it's based on funding and other rules and regulations, but when you're working in silos too much, you're not working effectively together, and we're not able to solve the major issues that we're seeing. And so working together in a collective is really important. We are doing that in our agency with the VA. for instance. So that's a very bureaucratic agency, very difficult to get through there. And so we found a way to partner with their housing team, that's their HUD-VASH team, and partner with SHRA, the Sacramento Housing and Redevelopment Agency, to work to get housing vouchers into the hands of veterans faster than they were before, to clear backlogs. And it's just working together to be able to make sure that we have a collective goal. Working through some of our barriers has been really beneficial. And so I think doing more of those partnerships to see how we can think collectively outside of the box, how can we break through some of the red tape, is really going to be impactful and helpful, because we all have the same goal in mind. It's just getting on the same page on how we do it.
I think coupled with that also, at least from what we've learned being the outsider looking in, is the communication. No one understands what is occurring. So what is the county doing? They're spending $180 million on what? What is the city spending? What are all these entities spending? Who is compiling that information? So the community, and I say the greater Sacramento region community, understands what is being done to solve homelessness, because no one understands that now. So I think that's key to move forward.
So for us across the bridge in Yolo County, one thing that we've thought about extensively was a regional collaborative effort, a strategic plan regionally to address homelessness. Luckily, I met Lisa Bates at a conference recently, and as I was in my tenure as chair of the COC, I reached out to her on many occasions for support. So if the COCs are working collectively, I think it will garner better results regionally. One of the other things that came to my attention recently, we were part of the PIT count, which is the point-in-time count for homelessness that HUD requires COCs and counties to facilitate. And as we were counting the encampments along the river in West Sacramento, we encountered many individuals. However, we could not count them because they didn't spend the night on the West Sacramento side. So there are all these nuances that goes along with the homeless response system, the continuum of care, the rules and policies of our federal government. However, if we are working collectively as a region, why not create a regional strategic plan? Why not create a regional action plan where Yolo County, we're right across the bridge, can be involved in problem solving regionally?
You know, I'm a believer that a strategic plan and having an action plan where there is progress and you follow it. I was really excited that this past summer, the Homeless Council created that. I think it was the first time that I saw something that I looked and said, this is going to be great because they're actionable items. We'll be able to track it, and we'll be able to, I think, move forward and stay on top of progress. So I think that, for me, it was a really big step to, and I was really excited about where we're headed now. And so can I just say great job to Lisa Bates, because she really is fantastic, and she has a heart, and she is very driven into seeing homelessness come to an end.
I think we've reached... Thank goodness for Lisa, yeah.
Yes.
I think we've reached a point where almost anything we do to help people who are unsheltered will make things better than they are right now. I think everyone would agree. And I'm not sure how many communities there are now that don't experience a huge burden of people who are unsheltered. So I think the consensus is here. We've got a strategic plan. It took a long time for SAC Steps Forward to even be acknowledged as the place that was the convener, because we seem to get lost in the weeds and have these sort of urinary competitions between each other. And the reality is that we have a plan. The reality is that we've got something everyone can agree on. The reality is we have Valley Vision. The reality is we have GSAC. The reality is we have SACOG. We all need to read this thing. We all need to agree on it and stop with the piddly stuff, right? Because the piddly stuff is arguments about HUD funding and would HUD, we would love HUD to create some options for us that are complete sober living environments. But that's difficult, and we work on that with HUD. But once you get into the question of whether housing first is effective or not, you're getting lost in the piddly stuff. Housing First is effective. We can all agree on that. And we can agree that if it needs to be improved, we'll do that another time. Right now, there are people who are unsheltered. We saw Maslow's hierarchy of needs earlier on. People who are unsheltered aren't really anywhere on that hierarchy of needs. Shelter is the first one. And so the first thing before you move along in any way to find your identity is to have shelter. And we haven't even afforded people that.
Evan, may I please add that we also, as a community, we need to do some PR and marketing to the residents. The residents are the ones electing our representatives regionally. The residents need to be aware of this issue. It is a collective issue. We do have some people who are deeply connected to the issue because it has affected them in the past. And then we have some people who may not necessarily understand it because it has not been their lived experience. So one thing that I see that's missing, even from our strategic plan that we're working on in Yolo County, as well as strategic plan, the Sacramento strategic plan, I'm not sure if that's included in it, is the outreach to communities. And that is messaging all across the board, separate messaging to separate communities about how homelessness is affecting our region and how this is a collective effort. It's not just the nonprofits or the cities or government. It is a collective issue.
Jeneba, that's a great segue. So I think my last question for everyone, and I loved Alicia's data on kind of the feelings that are evoked for people around homelessness, and that the majority is the sadness that you feel and that when kind of in the presence of human suffering. I think for everyone in this room, I guess my question would be kind of what's the call to action? What's your ask of the people here, and how can we start thinking about this maybe in a little bit of a different way?
Just from my experience, I work with several nonprofits in the city of Folsom, and we go out. We go into the Parkway, we go into areas, and I just want to hear people's stories. And one of the things that I am just really big on is when I meet people that don't have the ability to communicate their needs, I have a problem with that. I have a problem when we don't meet their needs. There are people with, again, as I said earlier, that have severe mental health issues that cannot fend for themselves. Not enough action is being made to help them with their needs. Where, I use this analogy, we don't let dogs roam the streets, but we let humans with severe mental health issues that cannot take care of themselves live in the streets. And so I think my call to action is, what can we do, or it's to, I think, support getting help for those that have severe issues, mental health issues in general, and get them the help they need.
I'll jump in really quickly. Alicia said it great. It was a wonderful presentation. I think we need to call it out, that this racist system is working exactly how it was designed to do so, and make sure that we have representation in the solution. So SAC Steps Forward and the COC have done a really good job of making sure that we have people with lived experience or lived expertise of homelessness in the conversation, in the room, really making those decisions, helping to lead the conversation. And I say also representation of people who are experiencing homelessness, making sure it's reflective in our leadership and not just at our frontline staff is really important as well.
I would, the majority of WellSpace Health's board are active consumers of our services, and the majority of them came to us when they were unsheltered. So I am governed, and my boss is a group of people, the majority of whom were homeless, and are evidence that services will help. I think we just need to embrace the plan. We just need to take the plan. Really smart people have come up with it. There are 6 items in it. We should all just agree on it, and we should use everything we have to evangelize this plan for our region and just embrace it and go with it, and not get into all the weeds. This is the plan. These are the 6 items, and we use all of the venues that we have and all of the tools that we have to just go with it.
I would add that our voices are very important, everyone's voice here in our community, and as we continue to speak to our elected officials, voice the need for funding to continue for creating shelter space, for also the city and the county of Sacramento to work cooperatively together to create some MOUs, to have centralized intake, and to continue to fund, and not fund, but to continue to fund shelter space and support services, and especially from the county's perspective, those support services. And I think all of us, that is our role, that is our call to action, to ensure that our voices are being heard to those that we have elected.
So for me, I always go back to the yogic principle of collective consciousness. So the more you increase someone's empathy, consciousness, and compassion surrounding an issue, the more you're able to move the needle on that issue. And that's why I say the public needs to be involved in this. We have a plan, we have the systems in place. However, if you have not had a lived experience of being a refugee, of being an immigrant, of being homeless, or if being on drugs, or had all these different challenges affect you, you are sort of disassociated from that. So you know how we have a public campaign about anti-smoking or anti-this, anti-that? We need something like that as a state for homelessness and housing. Many people may not feel connected to the issue, so they tend to ignore it. But when something happens to you, or when you have some awareness about it, you start to really think about how your actions are affecting others. So that would be my call to action. I know it's a little esoteric, but that's me.
I love it. That's a great place to end. I want to thank you all so much for being here and also for the work that you do on this issue. Thank you. And same to Lisa as well. Thank you so much for your time today and your work.
It's only 10.